So this is Dr. Berman. It's November 16th. We're doing yet another SmartLipo. We do them almost every day. This delightful lady is awake, got a little out of in, but it's quite animated. And what we're doing is we're doing her upper and lower abdomen and then flanks. So later on, I'll show you the other side. I've made a little incision. I'm gonna make actually 4 tiny incisions, 1, 2, 3, 4, but they're only a couple of millimeters. This is the cannula that will numb her up, connected to an IV bag with a lot of local. And as you can see, I just slip it in quite gently. When I step in the pedal, I'm filling up her abdomen with numbing medicine, and it always works. Nobody has any significant discomfort, and hopefully absolutely no discomfort. And it's got a little epinephrine in it, so usually most people don't bruise, but I can't promise that. So this is the very first stage where I numb her up, and then I'll show you the subsequent stages. But she's alert, she's been chatting with me during this whole period, and she should get a great result. I almost always encourage my patients to use this as an opportunity to really clean up their lifestyle, particularly their diet, because there's no magic. I'll definitely reduce her fat, but if she wants to look her very best, like almost all of us, if she does better dieting, better eating, and reduces her body fat, she's gonna get an even better result than if she doesn't change things. So we're now at part 2. Her abdomen's full of lots of numbing fluid, so she's definitely gonna be comfortable. This is the fiber optic laser fiber. You can see the guide light on my hand. It's not firing, you just see the light there. And then what I do, you can see it's very tiny. It's only about 1 millimeter. It has a temperature sensor, so it's extremely safe. And as you can see, I just insert it and gently move it back and forth. And you're comfortable, right?
Yep.
Yeah, there you go. And she's wide awake. You hear the clicking sound of the laser. That's melting her fat, giving her some degree of skin tightening. And I just will be doing this for quite some time, melting her fat, and then I will suck out the fat. So this is the last part. We've now lasered her abdomen, but the laser doesn't suck at any fat, it just melts the fat. This is the blunt tip cannula that I like. It's not too large, so it's very gentle. Got 3 holes, and you can see, again, it's a very gentle movement. And I'll be doing this quite extensively over her abdomen, upper and lower abdomen, and then we'll turn her over and do the flank area. So again, you can see there's fat coming out the tubes, and just a small quantity with each pass. And then when we're finally done, we'll close up the incisions with 1 little tiny dissolving suture in the Steri-Strip, and she'll be able to return to work tomorrow, and she'll be able to start exercising as hard as she wants in 5 days. But it's important to remember she'll keep improving for 6 months. The front of her abdomen, her upper and lower abdomen, with a really nice result. I can tell already because I've done so many. And again, I've made a little tiny incision. I slipped a little cannula in, and now we're gonna infiltrate her flanks, which is this area, and of course this area. So it'll take some time. I go nice and slow, so I allow lots of time, and it's very comfortable. She got through the front, and tell us how easy it was.
Super easy.
There you go. There's our star patient. So she has a little out of in and ward, but isn't asleep at all. There's no IV, so it's really comfortable. So we'll just fill up the flanks, get them completely numb, and then we'll repeat the same process with the laser and the liposuction. So I've made 2 little incisions. As I said, we've numbed them up. This is the fiber optic laser, and we're just gonna repeat what we did in the front. I'm in her flank area, or the love handles, the other name for it, so love handles. And I'm just going gently with the laser, and that's melting the fat, and she's completely comfortable. I'll do this for quite some time, and then we'll switch over to the liposuction. As I said, we've already completed her upper and lower abdomen on the front side. So I've now completed lasering the love handle area, and there's no fat coming out until I liposuction. So the laser just melts it. And now again, as you can see, it's a gentle movement. I did it some from the front side, and most of it's going to be from the back, because that's where most of the fullness is. And this will give her a much nicer figure. And like always, I encourage patients to adopt a healthier lifestyle, a healthier diet, because it's really a partnership. They can have a nice influence on the final result.